Hello, I'm Dr. Schmetterer, and I wanted to speak with you today about a subject that's near and dear to my heart, and that's the control of bleeding and saving lives. For over 30 years, I've had a good deal of experience performing heart, lung, and vascular surgery, as well as experience in level 1 trauma units, and I'm well acquainted with bleeding and how to control it. But to be honest, I have a lot of help. When I'm working in the operating room, I have assistants, I have nurses, I have anesthesia, I have blood products, I have instrumentation, I have lights, I even have good music. But out in the community, when people are injured, no one has any of that. And every one of you really ought to understand some of the basics for how to stop bleeding, because if we can't stop the bleeding out there in the community, then the patient's not going to make it to the hospital so that I have the chance to fix the problem and get them back up in working order. Now, the American College of Surgeons has a program called Stop the Bleed, and there will be a link to that at the bottom of this post. They offer free training, but what I'm going to try to do today is just give you the basics of what is taught by the American College of Surgeons and how to stop bleeding. Now, let's say that you're out at an event. You could be driving down the highway, you could be at a concert, you could be walking down the street, and something happens, and suddenly somebody is bleeding. Now, there are several steps, but they're easy to remember. The first thing is be aware of your surroundings. You want to look around. You want to see if you're in a safe place. You're not going to be good to anybody in the middle of a highway with cars racing by you. You're not going to be good to anybody if bullets are whizzing over your head, or if there's a madman with a knife stabbing everyone in sight. So you have to get to safety first. So look around, get yourself and the victim to safety, and while you're doing that, shout out to someone to call 911. Make sure to tell them to send the location. If they don't know where they are, everyone has a phone, everyone knows how to use Google Maps, and you can send a pin to the emergency responders. Once you've brought yourself and your victim to a safe location, you want to assess the bleeding. If you see slow oozing of dark blood, that's a venous injury, and that's the easiest to control. And just pressure, firm pressure on the bleeding site, maybe put a rag or a shirt or a coat between your hand and the victim, but that ought to control it. The trickier one, though, is if you see bright red blood and it's spurting. That's arterial bleeding, and that victim is not going to survive very long if you don't control that bleeding. So there are a couple main points that need to be considered. If the bleeding is between the collarbone and the upper thighs, so we call that the torso, this is going to be a wound, a hole, and it could be small or it could be rather large. And what you need to do is pack that wound. So Jessica, if you could just show me with your hands something that would maybe simulate a smaller wound. You'd need to take a piece of gauze, and you could tie a knot on the end of it, and you're just going to stuff that gauze into that hole and use kind of a hand over hand, finger over finger technique until you've stuffed that hole with gauze, and then you're going to put all your weight on it. Okay? Now, if the injury is much larger, if it's a larger hole, then you may have to take a t-shirt or cut strips of cloth and pack it into that hole as deeply as you can, and then put pressure on it. Now, what to do if the injury is on an extremity, an arm or a leg? Well, people think that wrapping a towel or a belt and cinching down is going to solve the problem, but it's not. It's not going to create enough pressure to stop arterial bleeding. You actually need a tourniquet, and I'm going to show you. This is called a CAT tourniquet, Combat Application Tourniquet, and the important thing on this tourniquet is this plastic bar. It's called a windlass, and that's going to enable you to generate sufficient pressure to stop bleeding. So Jessica's going to act as though she's got a spurting wound, maybe of her brachial artery, and you just put that tourniquet on. You want to get it about 2 or 3 finger breadths above the injury. So if the injury is here, you're going to go this high. You're going to crank it down, and it's not very tight at this point. Now we're going to engage the Velcro. It's still not very tight, but when I start to turn this windlass, okay, it's going to get very tight very quickly. And you see Jessica's making a face, and there's a way to lock it in place, and then on this little strip here, you can write the time that the tourniquet was applied. and you want to keep turning that windlass until, and it's going to hurt, sorry. You keep turning that windlass until the bleeding stops. Otherwise, you're not doing them any good. So that's a tourniquet. Now, if you don't have one of these, and you can get them on Amazon for a couple of bucks, if you don't have one of these, you can take a strip of cloth, same idea, wrap it around, tie a knot, get something like a pen, okay? Put that on there, tie it again, and same idea. You crank that. Is it getting tight?
Yes.
Yes, it's getting tight. And you crank it until the bleeding stops. There you have it. These are the steps to take. Be aware of your surroundings. Get to a place of safety. Put pressure on the wound. If it's venous, if it's pumping arterial, you want to pack the hole. And if it's on an extremity, you want to apply a tourniquet. If you do these things, you can stop the bleeding, and the victim can survive until the emergency responders get him to the hospital. Give me a chance to fix him and get him back up and running. So, American College of Surgeons, stop the bleed. Thank you.